Right now, there are people sick in Colorado who need treatments like chemotherapy, but they're caught up in a confusing system. It's a system that some healthcare providers say can delay their care and even expose them to unsafe medication. State lawmakers are now trying to stop what's known as white bagging, but if they're going about it in the right way is up for debate. 9 News reporter Anusha Roy joins us live now, and you have a closer look at this problem.
Yeah, hey, good morning, Corey. Right, in this kind of situation, an example tends to help a little bit. So if you look at an infusion center for cancer patients going through chemo, in some cases, an insurance provider or a pharmacy benefit manager might say that site needs to get medications from a specific specialty pharmacy that might be able to negotiate lower prices for those medications. Could also help out smaller providers who may not have the infrastructure to take on the financial risk of stocking expensive drugs. But critics are saying that it also means that healthcare site doesn't always have control over the drug supply chain. So if a doctor needs to make a change to patient care, like before chemo, based off of labs, that does happen, the doctor doesn't always have as much flexibility as they might need. All of that can lead to issues that you just mentioned. Critics say unsafe meds, delays in care, and extra costs. So now there is a proposed bill to try and stop that. When we asked one of the bill sponsors how often this is happening, this is what she had to say.
If the legislation is needed, it's enough to take action. It's as simple as that. We want to make sure that no infusion center has to go through this. And what I mean by that is that we want to make sure no person has to go through this. It can really mean life or death for someone when they have to have their care delayed.
The Colorado Pharmacists Society said that they believe that this bill is actually good, but it's too narrow at this point. So they are working to make it broader and apply to more healthcare settings. Meanwhile, the Colorado Association of Health Plans said that this practice of white bagging can actually safely distribute these drugs at a lower cost without markups on medications, and that for the bill to truly work, it has to include a prohibition on those markups, and also reimbursement rates need to match it as if the drugs were coming from specialty pharmacies. It's a pretty complicated issue, but one that does impact a lot of people here in Colorado. Corey, we're expecting this proposed bill to be back up for debate coming up on Wednesday afternoon.
Yeah, it can be very scary for someone who's going through this as well. Anusha, thanks for the update.